Okay, so today I'm going to respond to the questions from some of you about how to study pharmacology. Okay, so there are many ways to study. So here I just want to read something that was written by someone who wrote a pharmacology book. Okay, so it says strategies for improving test performance. So he said there are many strategies for studying and exam taking, and decisions about which ones to use are partly a function of individual habit and preference. However, basic study rules may be applied to any learning exercise. Test taking strategies depend on the type of examination. For those interested in test writing strategies, the Case and Swanson reference is strongly recommended. See references. So 5 basic study rules. Number 1, when studying dense textual material, stop after a few pages to write out the gist of it from memory. If necessary, refer to the material just read. After finishing a chapter, construct your own tables of the major drugs, receptor types, mechanisms, and so on, and fill in as many of the blanks as you can. Refer to tables and figures in the book as needed to complete your notes. Create your own mnemonics if possible. Look up other mnemonics in books if you can't think of one yourself. These are all active learning techniques. Mere reading is passive and far less effective unless you happen to have a photographic memory. Your notes should be legible or typed on a computer and saved for ready access when reviewing for exams. So dia kata bila you baca something, berhenti selepas beberapa muka surat and tulis dia punya summary lah daripada you punya memory. Okay, so bila perlu you patah balik baca balik apa you baru baca. Okay, bila habis satu chapter you baca, you cuba buat satu table table of the major drugs drug yang utama, the receptor types, mechanisms. Okay, and then you cuba isi lah sebanyak mungkin ruang kosong yang ada. So bila perlu you patah balik kepada jadual dan juga gambar rajah yang ada dalam buku untuk kelengkapkan nota you. So buat mnemonik kalau boleh, kalau tak tengok tempat lain dalam buku ataupun boleh tengok dalam Google lah boleh Google atau boleh suruh ChatGPT buat mnemonik for you. Okay, kata number 2, experiment with other study methods until you find out what works for you. This may involve solo study or group study, flashcards or text reading. You wouldn't know how effective these techniques are until you have tried them. Number 3, don't scorn cramming, but don't rely on it either. Some steady day by day reading and digestion of conceptual material is usually needed to avoid last minute indigestion. Similarly, don't substitute memorization of lists, example the keywords list in appendix 1, for more substantive understanding. So here dia kata macam cramming ni tak apa boleh, tapi jangan cram je tapi tak study sikit-sikit setiap hari So you kena juga study secara cramming, secara binging yang macam gila-gila punya, pulun punya last minute dan sebagainya. Tapi you juga perlu study slow-slow sebahagian benda setiap hari, dan juga sebahagian benda memerlukan masa lebih lah untuk you hadamkan maklumat tu. Number 4, if you are preparing for a course examination, make every effort to attend all the lectures. The lecturer's view of what is important may be quite different from that of the author of a course textbook, and chances are good that exam questions will be based on the instructor's own lecture notes. Okay, this is important. Number 5, if all test questions are legitimately available, as they are for the USMLE and courses in most medical schools, make use of these guides to study. By definition, they are a strong indicator of what the examination writers have considered core information in the recent past. Okay, strategies applicable to all examinations. So 3 general rules apply to all examinations. When starting the examination, scan the entire question. Okay, this one is for examination. I think I don't have to tell you. Maybe next time I will talk about this. See you people next time.